Good evening. I am Professor Amitabh Banerjee, an epidemiologist who is the author of Pandemic Third Eye. Hopefully, the COVID pandemic is over. However, there are alarms of a monkeypox being assuming importance of public health emergency. So I have started, like after finishing the book reading on COVID-19 pandemic third eye, I have been reading some of my columns written during the pandemic period. And during this COVID pandemic only, the monkeypox alarm went off, where in 2022 July, sometime in mid 2022, monkeypox was declared a public health emergency of international concern by Tedros. At that time, I had written a column in National Herald. The date of the column and the column was written on 22nd July 2022, and the title was Monkeypox: Surveillance Needed of High Risk Groups, but not the entire population. This was the title. This was to allay the fears of monkeypox among the common citizen. And now, since again the monkeypox is in the news, I thought I will give an update on this column because I have got some more figures since then where we can calculate the lethality and the possible course it can take based on the experience of the outbreaks in Europe and USA in mid 2022. So what I had summed up was the message of this column was almost all patients affected by monkeypox thus far have been male, with 3/5 of them being homosexuals. So what India needs to do is to closely monitor the high risk groups, not everyone. Not only India, other countries also, because we came to know the epidemiology of monkeypox outside Africa. It was in the adults and it was confined to people with some high risk behavior. So I'll just go through this and try to update and give some commentary wherever relevant. Close on the heels of COVID-19 pandemic, which experts are convinced, the experts are convinced is not yet over. That was in July 22. The spectrum of monkeypox has started playing havoc with our psyche. Hyperbolic TV channels have helped cause alarm, and the government has asked ports and airports to strictly screen international passengers. It is not clear what they expect to find since it apparently takes 3 weeks for the symptoms of monkeypox to manifest. So, person may appear normal when he comes to the airport, when he boards the plane, but he may develop symptoms later. So, it has an incubation period of 2 to 3 weeks. After the infection, the person may be normal for 2 to 3 weeks. So, this will not achieve anything. This will not. The name monkeypox itself is a misnomer. The name has its origin in the discovery of the condition in captive Asian monkeys in Copenhagen in 1958. So it's not a new virus. 1958, almost 75 years. The virus survives in nature among small animals like squirrels. So it was found in a lab and in a monkey, which again is not a natural host of monkeypox. Very few monkeys have been found to carry the virus or the antibodies. Monkeypox virus belongs to the same family as the smallpox virus. So there can be a panic in the public mind because the fear of smallpox is still there because it was a historical, the history, public health history is full of the havoc smallpox had created. Fortunately, while the eruptions have some resemblance to smallpox, the skin lesions have some resemblance to smallpox. Monkeypox is a poor cousin. It is mild and self-limiting, with case fatality rate varying from 0 to 10% in Africa. 0 to 10% Africa, which tends to move towards zero outside Africa. Africa, perhaps due to better nutrition and access to healthcare. Africa has got a lot of handicaps, like mostly in Africa, monkeypox is affecting the young children who go to the forest and handle those carcasses of small animals, which are the reservoir of monkeypox virus. And most of the African children, about a high proportion of African children, 30% around, are undernourished, poor nutrition. So that makes them vulnerable to any infection. So probably that is the main reason of a high mortality. And the symptoms of monkeypox infection is fever, muscle pain, swollen glands, lymph glands, rashes, skin rashes, red rash, it may raise to the surface, macule, papule, they call it, then it may form a vesicle. It may fluid filled lesions like chicken pox, and it is little towards it. So rashes which have to be differentiated from chicken pox and other cases of fever with rashes. Human to human transmission is by intimate contact, while respiratory transmission is possible but not very efficient. So it doesn't spread very efficiently by respiratory route. The course of the illness is 2 to 4 weeks. Smallpox, in contrast, has a case fatality rate over 30%. So it is nowhere as lethal as compared to smallpox. The smallpox endgame, how monkeypox came to the surface? It was there for, I mean, 1958 it was discovered. It may be there earlier also in Africa. The smallpox endgame in the 1970s unearthed cases of monkeypox in Africa, because when they were going for smallpox eradication, they started house to house search for smallpox and for asking the every household any member has got some lesions. So there during smallpox eradication, surveillance activities were intensified. This reveals scattered cases of monkeypox in the African continent. So since the lesions resemble smallpox, those people came forward and they were found these are not smallpox, but monkeypox, which is very mild compared to smallpox. In the 1980s, WHO carried out serological and virological studies in Congo. Antibodies were detected in very few monkeys. As I said, monkeys did not show sign of infection, though it is named as monkeypox. And antibodies means if once a person gets infection, his body produces antibodies to fight it, and that remain in the blood and serum for some time. And then they can do the survey and find out whether the virus has passed through this. So in animals, monkeys did not have much signs of infection. Antibodies were found in Gambian rats and elephant shrews. Elephant shrews are again small mammals. The name is elephant, but it is a small mammal. Three-fourths of the human cases were children. Africa, में 75% were children due to intimate contact with animals or due to handling their carcasses. The secondary attack rate was 8 to 9% within household contacts. So only it's not very infectious from person to person. So these things do not make this as a potential agent to cause a pandemic. So this one should keep in mind, because since COVID, the science has been neglected. So we should see the science. The data does not predict that it can become a pandemic, unless, of course, it's a modified virus lab and all that. We don't know. The case fatality rate in the African continent range from 0 to 10%, the Western African strain being less lethal than the Congo strain. Congo strain is slightly more lethal, and now they are saying the Congo strain is spreading. In 2003, monkeypox infection of humans was identified in the US first time. This was traced to prairie dogs. Prairie dogs are again small animals like squirrels and other things. So name is dog. It's not a big dog. It's a squirrel that were infected from Africa, that were imported from African infected as animals from Africa, imported as exotic pets. Gambian rat, rope squirrel, and dormouse from the African shipment of exotic species originated in Ghana were implicated. So import of small animals which might have been infected, they thought most likely these are the cause of the infection spreading to USA in 2003. Now the biggest outbreak of monkeypox outside the African continent began in May 2022, middle of 2022. By mid-July 2022, over 14,000 cases have been reported from 70 countries. This was, I had written this column somewhere in July. So over the 2 year, that time, 14,000 cases. European Union and UK reported 6,000 plus cases, almost 7,000 first week of July. Majority of cases, 42% were aged between 30 to 40 years. And in 99.5% were males. So it was affecting exclusively males. So there is a very defined high risk group. So general population is not affected. Only males, and majority 99.5 were males, and majority of them were homosexual, gay, with multiple sex partners, more than 10 partners. Majority, and only around 10%, only 10% needed hospitalization, and only 3 needed ICU admission. So out of thousands and thousands of cases, and subsequently I have updated the data. This was when I wrote the column. Over a 2-year period, there were about 1 lakh cases from 80, 90 countries, 95,000 plus, almost 1 lakh cases, and there were only 180 deaths. So that gives an infection fatality rate of 0.19% or 0.18%. So the fatality is very less, and most of the fatality was people with co-infection with HIV. HIV, most of them had HIV, who had monkeypox and other sexually transmitted disease. So as it is, the infection fatality is 0.19, and that too majority who have. So for a healthy person, for a person without any high risk behavior, monkeypox is not going to make an impact. Best way to control it rather than declare it a public health emergency is to focus on the high risk groups, the gay, homosexual. It is transmitted by close intimate contact, body fluids and other things, not by respiration. It may be very rare, inefficient. So just like STD and HIV control, condom promotion, safe sex, to have multiple sex partners, and IV needle and those. So majority of cases, as I said, then interestingly, 43% of the affected were HIV positive, and around half had history of other sexually transmitted disease. There were no deaths that time. This was in July when I wrote. After 30, 40,000 cases, there were no deaths. So you can imagine, only 0.33% of the cases were healthcare workers. So healthcare workers are not an extra risk. That means it's not very contagious from person to person. So where is the pandemic risk? None died. Genomic studies indicated that the West African strain was responsible. This time they are saying it's Congo strain, but still, let us see the death rate. In the UK, which had more detailed data, 97% of the cases were homosexuals. 97% were homosexuals or bisexual men. Of this, 54% had history of other sexually transmitted infections, and 30.8% had 10 or more sexual partners in the last 3 months. So imagine. So these are the high risk people who live in the fast lane. So do we cause panic among the general population? That is the question from the data. Preventive strategy, what I had suggested in the column was, beyond Africa, monkeypox is behaving like a sexually transmitted infection. Therefore, promoting use of condoms in high risk groups appears to be a clear priority. 2 cases have been reported in India at the time of writing. With our experience of HIV control, we can take on monkeypox surveillance among the high-risk group, such as HIV patients and STD patients with the same infrastructure. A self-limiting disease with almost zero mortality in the healthy with access to healthcare should not be cause for panic or stigma. Modified smallpox vaccine is being recommended for monkeypox. So this is very surprising, and it's coming full circle. Edward Jenner used the cowpox vaccine, which is related to monkeypox, which is mild like monkeypox, and he used that cowpox lesions to inoculate against small. And now we are going back. We are taking a more dangerous smallpox vaccine for a milder illness like monkeypox. So Edward Jenner must be smiling from the heavens. What is happening? So I just wanted to convey this. Let us have more data on the whatever they say this time. It is a new strain from Congo, which is slightly more lethal, but it's outside Africa, and it's a 75-year-old virus. So why suddenly it should become? So these are the things we should ask the policymakers, the so-called experts, the elected representative, rather than pressing the panic button and vaccinating the masses. If you have to vaccinate the high-risk group, see the efficacy of vaccine. And as long as the general the common person should not be should not panic, and they should not be unnecessarily inconvenienced. Thank you.